All right, thank you very much, Chisom, for having me. Could you please confirm if you can hear me clearly on your end?
Okay, yeah, I can hear you.
All right, good morning, good afternoon, good evening, depending on your time zone. My name is Godwin, and it feels really good to be on the call with you guys today. I am super duper excited for the amazing work that Chisom and our colleagues are doing, and very grateful to everyone for making our time to be on the call. It is indeed an opportunity for us to learn, for us to unlearn, for us to relearn most of the tips and the strategies that we need in order for us to contribute towards curbing the rise and spread of the challenges of antimicrobial resistance in different settings. And when I say different setting, I mean in human health, in animal health, in plant, food system and agriculture, and even in the environment. So I'm very happy to be here, and I've been assigned the responsibility to engage us on the topic that you can see on the screen. The theme, as you must have been informed, is from awareness to action, from awareness to innovation, strengthening action against antimicrobial resistance. And I've been asked to demystify the strategic objective 5 of the updated global action plan on antimicrobial resistance. And that particular objective touches on accelerating antimicrobial resistance research and innovation across all sectors. I'll be very grateful if you could get a pen or a piece of paper or something around you via which you could take note and jot down some important points which I believe will be very useful to you as a researcher, either as an early career researcher, a senior or a mid-career researcher, or as someone out there who is just passionate about addressing the challenges of antimicrobial resistance. I really want to say a big thank you to Vanessa for being so kind and generous, to share her stories, her lived experience with antimicrobial resistance. It was so touching to see all that you've been through, and I'm very happy that you're taking the stage to share your story to help people feel AMR, because more often than not, we get to talk about AMR from the distance. We talk about it like an abstract term, but listening to you today actually brought the message closer that there's someone out there who had drug-resistant infection and passed through a whole lot. She survived, and she's sharing her experience to inspire others to use antimicrobials prudently in their various settings. So, ladies and gentlemen, if you are ready, I am ready. Let's dive in deep to my own responsibility today. Uh, Strategic Objective 5 of the Global Action Plan on Antimicrobial Resistance. So, what exactly does Strategic Objective 5 of the updated Global Action Plan on AMR say? Particularly, the Objective 5 talks about accelerating antimicrobial resistance research and innovation across all sectors, across human health, animal health, food and agricultural system, and the environment. How do we do this? How can we um, increase research? How do we make sure that research is well done in different sectors, in different settings, in different geographic locations? So that is what strategic objective 5, is all about. And my job today is to see how we can demystify what this objective is talking about and what is your role as a researcher in a high income country or in a low and medium income country, or irrespective of your background. What can you do? What can you contribute? And what role can you play to helping us, to helping the WHO or the quadripartite organization to achieve this strategic objective that is called strategic objective number 5. So I would like to start with a question, and the question actually comes with how. And how, in the sense that we have an objective that we want to achieve, and we want to accelerate research and innovation in antimicrobial resistance across different sectors. How are we going to do this? And, how do we demystify this that everybody can actually understand it out there? So I feel it would be good for us to have a quadrant. So I drew a quadrant trying to break down the various segments of what the strategic objective 5 of GAP GAP-AMR is talking about. Then, in the GAP-AMR objective number 5, there are 4 major sub-themes. The first one is strengthen multidisciplinary AMR research. The second one is scale up research, development, and innovation. The third quadrant, talks about sustainable financing for antimicrobial resistance research and design. And then, the fourth quadrant talks about building research capacity and accelerating uptake of innovation. These are novel sub-themes that are found in strategic objective 5 of the Global Action Plan for Antimicrobial Resistance. If you look at this carefully, you can see that I feel within me that there are some persons that can be held responsible to implement each of these sub-themes that we have under strategic objective 5. And after careful thought and doing my own digging on this particular subject, I feel for the first quadrant, we could have researchers, universities, research institute, ministries of health, agriculture, and the environment, and the quadripartite or funding agency. It could be their major responsibility. It could be their responsibility to strengthen multidisciplinary antimicrobial resistance research. Then for the second quadrant, I feel it is the responsibility of the government, pharmaceutical and biotech companies, universities and research institutions, industry, and again, the quadripartite and some wonderful donors out there. It could be their responsibility to actually scale up research, development, and innovation. And then if you look at the third quadrant, I feel to ensure sustainable financing for AMR research and design, it could be the responsibility of government. It could be the responsibility of multilateral organizations. It could be the responsibility of development banks, donors, philanthropies, public and private partnership. See, so these are just my thought. It's not written explicitly on GAP-AMR. It's not written explicitly in the GAP-AMR updated document. I thought carefully about the various sub-themes that I feel these individuals could be held responsible. It could be their responsibility to actually carry out, the various tasks that are actually available here. Then, if you look at the fourth quadrant, who could be held responsible? I feel universities, research institutions, researchers, governments, development partners, professional societies, and the quadripartite. So, ladies and gentlemen, if you look at the objective 5 of the Global Action Plan for AMR carefully, that has these 4 quadrants, I feel it is, if you look at it carefully, you get to maybe share the same sentiment with me that this looks like the responsibility of government. This looks like the responsibility of international organization, and this looks like the responsibility of major funders, who can play good roles in helping us to, increase research in antimicrobial resistance. But then, if you look at the center carefully, I feel that it's a circle that connects the dots, that connects the various sections of the quadrant. So the first one is, a sector that is connecting the first quadrant to the second quadrant to the third quadrant and then to the fourth quadrant. And the question is, what exactly is this circle? After careful consideration, I feel the circle in between is, a circle. It's more like the circle of life, a circle that has a very big question for you and for me, and that is the question of how can you contribute? How can I contribute? How can we contribute? How can I, as an individual, even though I am not, a government agency, even though I'm not an international organization like the quadripartite, the WHO, the FAO, WOHA, and UNEP, how can I, contribute as an LMIC researcher, who does not have major funds and all of that? What role can I play to helping the world achieve strategic objective 5 of the Global Action Plan for Antimicrobial Resistance? So that is what we are going to focus on today. And based on this, I decided to reframe the topic assigned to me a little bit. I decided to reframe it a bit, and it now reads from awareness to innovation, how researchers can accelerate antimicrobial resistance research and innovation through the One Health framework. From awareness to innovation. We've been talking about awareness, we've been talking about, advocacy and all of that. How can we move from raising awareness about antimicrobial resistance, to innovating new ideas, new diagnostics, new strategies that can help help curb the rise and spread of drug-resistant bacterial infections? And what role can you play as a researcher in a locality, maybe in Africa, in Asia, in Latin America, or in the Middle East? What role can you play to help accelerate antimicrobial resistance research and innovation through the One Health framework? So that is what we are going to focus on today. And that takes us to the question of how can I contribute? What role can I play as a researcher? And I feel there are five major ways. There are five major ways you can accelerate antimicrobial resistance research and innovation through the One Health framework as an individual researcher. Now we have established that you are not a government, you are not an international organization, you are not a major funder, you don't have gigantic resources, you don't have, sophisticated labs and billions and millions of dollars of naira available at your disposal for research. How can you contribute to achieving strategic objective 5 of the Global Action Plan for Antimicrobial Resistance? So I feel there are five major ways in which you can contribute, irrespective of your location, irrespective of what cadre you are in, in your research. So let's look at number one. The first way I feel you can actually contribute to achieving strategic objective 5 of the Global Action Plan for Antimicrobial Resistance is, number one, you need to be aware that innovation is not synonymous with expensive laboratory research. More often than not, when we talk about research and innovation, what comes to the mind of many people is, I need to be in Oxford, I need to be in Harvard, I need to be in Cambridge, or I need to be in Texas Tech University to be able to do impactful research. Ladies and gentlemen, today I'm sharing with you that innovation is not synonymous with expensive laboratory research. And as an early career researcher, in whatever location you find yourself, you can contribute in achieving strategic objective 5 of the Global Action Plan for Antimicrobial Resistance by just being curious, by willing to know or wanting to know, by asking better research, like asking better research questions. And you do not need a sophisticated lab to ask better research questions. All you need is a level of curiosity, caring to know what drives antimicrobial resistance. How can antimicrobial resistance awareness be translated into behavior change? What's antibiotic prescribing practice in community XYZ? How are antimicrobials used in veterinary practice? What is the role of wastewater and pharmaceutical pollution in AMR? And how are national action plan for antimicrobial resistance being implemented in my country, in my locality, in my state, and all of that? You can contribute. You can contribute excellently well in achieving strategic objective 5 of the Global Action Plan for Antimicrobial Resistance by simply just being curious, and your curiosity will lead you to asking important questions. That is very, very important. So you might agree with me or share the same sentiment with me that innovation is not synonymous with expensive lab research. You can be in your own corner of the world and be able to lead wonderful research that will make significant difference, that will inspire, that will influence, that will instigate change all over the world. And this is what we try to do at the Antimicrobial Resistance Knowledge Hub of the Global Health Network at the University of Oxford. And what we do is that we connect researchers, irrespective of their location, to resources, to tools, to materials, and toolkits that they can use to lead research in their own locality without having to travel down to Oxford or travel down to Harvard or Cambridge and all of that. So innovation is not synonymous with expensive lab research. I feel innovation begins with your level of curiosity, and your level of curiosity will lead you to asking better research questions to address the challenges of infectious diseases in your own locality. So let's go straight to number 2. I feel you can contribute to achieving the strategic objective 5 of the Global Action Plan on AMR by innovating by using existing data creatively. And how do I mean by this? For instance, most of global data sets, most of global information that you need in order for you to do research are readily available free of charge. For example, the WHO glass is like an assemblage, or let me say is a collection of fantastic information about antimicrobial stewardship. It's lots, thousands of informations are there, and your country might be reporting to WHO glass. So why don't you go there and see what information you can download from there, and what information you can analyze, and what insight you can generate from your analysis to be able to influence policy and to instigate change in your own locality. WHO or the quadripartite tracks is also a wonderful open resource that has thousands of data about antimicrobial implementation in human health, in animal health, in food and agriculture system, and even in the environment. These data are readily available for you. World Bank indicators, the FAO stats, demographic and health surveys, and national surveillance data, they are readily available for you. So, ladies and gentlemen, if you cannot afford primary data, there are secondary data that are available free of charge for you openly on the internet. You can go there and search, draw this data, collect them, download them free of charge, and use them to do secondary analysis. Again, you can also do questionnaire study, you can do community engagement studies. So I encourage you, and I am sharing with you today that you can contribute to achieving strategic objective 5 by innovating, by using existing data creatively. You do not need heaven and earth in order for you to be able to contribute to achieving this objective. From your own locality, with the tools and the resources that you have available at your disposal, you can start contributing, and you can do something meaningful that will help you to achieve that eureka moment. I found it, I discovered it, and discovering it does not need you to be in Harvard or in Oxford in order for you to do it. I'm not saying going to Harvard or Oxford is not good. It is good for you to go there, but don't wait until you get there before you start making meaningful contributions to addressing the challenges of antimicrobial resistance in various settings. Thirdly, you can contribute by building One Health collaborations. You can contribute by building One Health collaboration. And the reason I'm saying this is because it's not enough for you to work alone. Like, don't work in silos. Now look at the wonderful work that Chisom and her colleagues are doing. At the moment, it's no longer the idea of Chisom alone. She's bringing individuals from different parts of the world to contribute, to lend their support, or to share their ideas, to help people access information that can help them to contribute to curbing the rise and spread of drug-resistant bacterial infection in different settings. Collaboration. It is very, very important. Connect and collaborate with physicians, connect and collaborate with veterinarians, connect and collaborate with environmental scientists, pharmacists, microbiologists, social scientists, data scientists. My dear colleagues, innovation frequently emerges at these interactions. You cannot do it alone. The challenges of antimicrobial resistance cannot be addressed in silos. We need interdisciplinary collaboration. We need multi-institutional collaboration. We need interprofessional collaboration. Everybody has a role to play. And for you to make meaningful contribution, you really need to reach out to individuals. On the AMR hub of the Global Health Network, we have something called the Connect and Collaborate map. And it's a map that hosts over 600 individuals who openly pin themselves on the map, and they declare to the world that They are open to collaborate. They are open to mentor, and they are open to work with individuals on any research that borders around One Health, AMR, stewardship, diagnostics, and all of that. This is what I feel you can take advantage of. So you can contribute to achieving strategic objective 5 of the Global Action Plan for AMR by building One Health collaboration, connect with individuals, and don't work in silos. Number 4, translate research into action. This is very, very important. More often than not, a lot of us who are in academic institutions, we just want to do research, we want to publish paper, we want to make sure that our paper are cited, and we want to be proud of how many citations you have on Google Scholar. For me, I don't want my paper to get cited. And citation is not my drive as a researcher in antimicrobial resistance. What I'm interested in is that I want the outcome, like the output of my research, to be used by institutions, by the WHO, by the FAO, by UNEP, by WOHA, by the Nigeria Center for Disease Control and Prevention, by the US CDC. That is what I'm looking for. I want them to pick up my publication and look at the innovative idea that Godwin is presenting. What insight can we draw from this, and how can this be implemented in helping to address the challenges of disease and the spread of disease in our immediate environment? That is my endless desire. So, dear colleagues, work hard to see how you can translate research into action. Publishing paper is valuable, but impact comes, to me, it comes from being able to write policy brief, stakeholder meetings, community engagement, educational materials, decision support tools, media and social media communication. These are very, very important. These can make your work to be used, can make your work to be referenced, and you may not know, someone in one locality, in one part of the world, might be using your documents to make significant difference in their health system, and that will go a long way, in helping you to start contributing from your own local community. Finally, ladies and gentlemen, number 5, leverage available digital tools. Available digital tools, affordable digital tools, they are free of charge. You can use them at any time, at any moment, to help you lead research from your immediate environment. And when we talk about available tools or affordable tools, we are talking about tools like AI, like you can use artificial intelligence tools for idea development and for literature support. You can use online tools like SurveyMonkey, like Microsoft Form, like Google Form, to do research, like to design your questionnaire and to disseminate your questionnaire electronically. These tools are free of charge. Like their information system like GIS, which you can use for AMR mapping and spatial analysis, mobile-based data collection tools, and they are open source statistical tools like R, like Python, that you can use to analyze your data. Not every innovation, my dear colleagues, require advanced laboratory. More often than not, from your own little corner of the world where you are in right now, with the little resource that you have available at your disposal, backed up with high level of curiosity that will lead you to ask better research questions, you can begin to contribute immensely towards making significant difference in your own immediate environment. So what you don't have to wait for as a researcher in LMIC or in high-income country or in any part of the world are the following. Don't wait for $1 million grant before you start doing research. A relevant research question is more than enough for you to get started. Don't wait for the state-of-the-art laboratory for you to start doing research. Existing data sets, secondary data are available out there that you can leverage to help you do research in your own locality. Don't wait for multinational research consortium. Cross-disciplinary collaboration is very, very important. Don't wait for government approval. Open source tools are there for you to use. Don't wait for the perfect surveillance system in order for you to start contributing to addressing the challenges of antimicrobial resistance. You can engage local communities. For me, I feel you can do community engagement and you can make lasting impact in your immediate environment. So don't just do research to be cited. Do research that inform policy. Do research because you want the output of your research to be used to influence policy and to make significant difference in your immediate environment and all over the world. So I want to share with you this particular diagram on your screen, which I called the researcher's innovation pyramid. For you to become a researcher, or for you to innovate very well as a researcher, and for you to be able to contribute towards the achievement of the strategic objective 5 of the Global Action Plan for Antimicrobial Resistance, number 1 at the foot is curiosity. You have to be curious. Your curiosity will help you to ask better research questions. And with your better research question, you can generate quality evidence. It is not gigantic evidence. The idea is on quality, not quantity. If you are curious, you can ask better research questions. With your better research questions, you can generate quality evidence. With your level of evidence, you can collaborate across sectors, collaborate with people in human health, in animal health, in plant and in the environment, and even those who are working in food and agricultural system, and even those who are working in environmental healthcare, collaborate with them, translate evidence into policy, and with it, you'll be able to make significant impact in your immediate environment. So I'd like to say very kindly that innovation does not begin with funding. Innovation begins with your level of curiosity. How curious are you? How concerned are you that every year 1.14 million people are dying of antimicrobial resistance? This is not something that we just make jest of. I feel this is something that we all should take responsibility of. So why the role of government and international organizations are very, very important in achieving strategic objective 5 of the Global Action Plan for Antimicrobial Resistance, I feel we as researchers, we are very, very important. We can generate evidence, we can connect discipline, we can inform policy, and we can engage communities. Innovation begins not only in well-funded laboratories, but also with thoughtful questions, strong collaborations, and a commitment to improving the health of the people where we are living. Ladies and gentlemen, I really want to thank you for the opportunity to share with you today. I hope I must have inspired you in one way or the other for you to hold yourself responsible and for you to believe that with high level of curiosity, you can begin to do something significant in your immediate environment. Thank you so very much for listening. If you have any question, I'll be very, very happy to take them.
All right, please a round of applause for Mr. Godwin. If you enjoyed this session, please give him a round of applause because this was so wonderful. This was so wonderful. Like I was writing down all through this session. It was really amazing. Thank you so much. I think one thing I would say one sentence I think, yes, I would say that I've gotten from this particular session is that innovation begins with curiosity, funding comes afterwards. So innovation begins with curiosity and then funding comes afterwards. Let's bear that in mind. Okay, so any questions for Mr. Godwin? Any questions? Okay, before we go back to that question, we have one question earlier, but I wanted you to address it, Mr. Gordon. We had one question earlier. So the person said, how can we go about researching? You've already talked about it, but the person, that was before this session. So the person was like, how can we go about researching AMR, researching in AMR? The information is vast. How can one narrow it down? I mean, starting with basics before advancing. So that was the question the person was asking.
Yeah, thank you very much, Chisom, for that question. It's a very nice one, and I share in that person's sentiment that antimicrobial resistance is very, very broad, and sometimes you can get overwhelmed, with where exactly do I start from and what can I do. So the best way you can actually get busy with contributing your own quota towards addressing the challenges of antimicrobial resistance is by picking a niche. Picking a niche, like an area where you want to make contribution. You cannot contribute everywhere. For instance, I am very, very peculiar and very, very passionate about stewardship and policy. Just those two. There are people who are very passionate about diagnostics, community engagement, and all of that. That is their own area. There are people, I have colleagues who are vets, and they are very, very concerned about the challenges of antimicrobial resistance in animal production, in cattle pens and piggery and all of that. So you have to pick a niche where you want to become a leading voice or where you want to start making impact. And even if you don't have any niche at all, you can start from your community. Have you tried to carry out research on antimicrobial prescription practice, consumption practice in your neighborhood among the people in your street? It doesn't cost much to do that. Like, sincerely, you don't need $1 million funding for you to carry out a very short study as per antimicrobial prescription practice among the pharmacists that you have in your street or in the state where you are living in. A questionnaire will help you out, and you can get insight, and from this insight you can analyze it and draw sound and an intelligent insight from it and use it to influence policy in one area or the other. So I feel research in AMR begins with high level of curiosity, asking better research questions, wanting to know, and starting from where you are with what you have and with what you can do at the moment. That's what I think about it.
Okay, thank you so much. Chiku Gaziran, have you gotten the answer to this question? Yes, okay, that's fine. All right, so more questions for Mr. Godwin, please, before we round up this session. More questions, inputs.
Oh, Mr. Godwin.
Okay.
Good day. It's such a great opportunity to hear from you directly. You might have always seen Olajimoke video profile, on LinkedIn. I've actually been following you on LinkedIn for a while now. I just want to say thank you for the incredible work you've been doing. Nice. So my name is Olajimoke and I'm a clinical pharmacist. So currently currently I got involved in antimicrobial stewardship. So I want to ask that, as someone at the beginning of this career journey, because I understand it's actually a journey in antimicrobial stewardship, what would you recommend that one focus on over the next 2 to 3 years to make meaningful contribution in this field? And I think I'm trying to lean towards community engagement, because at the end of the day, with all this policy, all this innovation, all this implementation, if the people that are using the drugs are not informed, if they don't know their contributions towards this and what their actions could lead to, I think we are still rounding around a cycle. So it's majorly into community engagement. So what would you recommend, please? Thank you.
All right. Thank you, Oladele Jumoke, and I really appreciate your engagement on LinkedIn, and I hope we'll get to connect more and to collaborate. As if you look at my last slide, I am open for collaboration. My email address is there. You can reach out. Feel free. If there's any area you feel we can work together, share, reach out and let's work together. I'll be very, very happy to work with you. So now to your question, where do I start from, or what can I start doing? I love the fact that you are very interested in community engagement, and I feel that is a wonderful place that you can start from, because more often than not, we do research in the lab, or probably we analyze secondary data, we publish the paper in high impact factor journal, and it ends there. The research dies there. A community engagement specialist, okay, or Oladele, can actually take this research that Mr. XYZ et al. Have done and look at, okay, this is what they said, this is how antimicrobials can be used prudently in in communities or in different settings. And then you take this research and you domesticate the research to the needs of your local community members via community engagement, via town hall meeting, via roundtable conversation. Like, I see addressing the challenges of antimicrobial resistance far beyond publications, far beyond publishing research, far beyond Zoom calls and all of that. How many people, how many farmers in the rural areas do you get to have on Zoom calls when we organize webinars? They are not here. How many religious leaders do you have on the call when we have meetings to address antimicrobial resistance? They are not there. But as a community engagement specialist, you can take this information, go to the local churches in your community, talk to the pastor or talk to the imam, and beg for an opportunity for you to engage the audience in conversations, to expose to them the dangers of abuse, misuse, overuse, and underuse of antimicrobials in different settings. I feel these conversations will go a long way in making significant impact. Community engagement, my dear sister, is a very wonderful place for you to start as a pharmacist. Over here in the United States, I tell you, the regulations are not just strong, but the regulations are sophisticated. Like, Chisom cannot be ill and walk into a pharmacy and say, give me amoxicillin. It is completely impossible. No pharmacist will administer amoxicillin to Chisom. The question they will ask you is, where's your doctor's prescription? Can they check the system and see that your doctor has asked that Chisom should be given amoxiclav or should be given ampicillin or penicillin or something? If there is no doctor's prescription, forget about it, you will not get. But it is not like that in our own country where we come from. I'm a Nigerian and I know that I can go to the next available medicine store and buy as many quantity of amoxicillin as I want if I have the money to pay for it. So, my dear sister, start with community engagement. Even now that we don't have enough regulation and enforcement, you can start with, advocacy, enlightenment, enlightening people, enlightening members of your household. I can tell you guys proudly that my wife, if I was unable to come for this presentation, my wife can come here and make the presentation on antimicrobial resistance. Not because she is a microbiologist or not because she has idea. In fact, she's an engineer, but I have been enlightening her. She's very much aware of how we need to use our drugs from beginning to the end, how we need to use antimicrobials prudently. She's involved. So communicate with your family members, your church members, your friends, your classmates. Let them know antimicrobial resistance is not a silent pandemic. It is very loud. It is very, very audible. But most people are paying deaf ears to the sound that antimicrobial resistance is making in localities and in different settings. So that's just my advice for you, my dear sister. Start with community engagement. It's a very wonderful area, and you will make significant difference.
Thank you much, Mr. Godwin. I actually wasn't looking at that part, but then I guess it is what it is. Thank you so much.
Thank you.
Okay, so does anyone still have more questions for our speaker? All right. So, Mr. Godwin, please, will you make your slides available?
Sure, I can attach it right now if you don't mind on the chat. I don't know if it's possible to do it. I don't know. Okay, I will send to you. I can attach, but I'll share that with you, and you can make reference to it later.
All right, that's fine. Thank you.
Thank you, everyone, and thank you, Chisom, for the wonderful work that you and your colleagues are doing. I'm very, very happy and proud of the great work. Not waiting for international organizations to come organize events like this for us, but we as young individuals in Nigeria or in any African country or in any part of the world, let us play our role, organize meetings like this, invite professionals. I love the lived experience of Vanessa. It's touching. It helps us to understand that antimicrobial resistance is real I personally do not believe that it is a silent pandemic. It is not silent, it is loud. Didn't you hear what Vanessa said? Is it not loud? Is it not audible to our ears? It is. So let us keep doing stuff like this, and God helping us, we'll be able to curb the rise and spread of drug-resistant bacterial infection. God bless you, and thank you so much for having me.
All right, thank you so much, sir, for having us as well. Thank you, thank you, thank you.